Orthopaedics, the femur. A lot of conditions are based around the femur. Bent AO nail calcification of femoral versus adult. Calcification of the femur. Bilateral femoral shaft fracture, but unusual. I need IM nails. Common neutered supracondylar fracture. 11-year-old. Car accident. Bilateral stress fractures, femur, 70-year-old. Donway splints, useful. Broken AO nails. Large IM nail fixation, failure. Broken AO nail. Failure ORIF lower femur. Hasn't united. And again, pathological fracture infection. Failure ORIF. Fractured femur held in traction before surgery. Fracture lower femur and tibial plateau fracture in 49-year-old, quite a devastating injury. Fracture of femur in 2-year-old, managed non-operatively. Femoral shaft fracture, 48-year-old, fixed. Femoral midshaft fracture, treated in traction, 4-year-old, seldom operate on those. Self-explanatory. Fracture femur, 16-year-old, best to put a nail in. Fracture midshaft femur. Fracture lower femur and patella, fix both. Growth plate arrest lower femur from supracondylar fracture and crosswire fixation. See, this commonly fails, or fuses, Huck step nail in place for a 21-year-old, useful nail. Liposarcoma, look at that mark spelling there. 34-year-old excised. IM nail, liposarcoma, posterior thigh here, excised. IM nail, 25-year-old set up for surgery. Multiple myeloma and shaft. See the lesions down here, pathological fracture. Infection about canal, multiple myeloma. Canal to femur, this is the car that was smashed up from a 22-year-old injured. Like liposarcoma, already shown. Myositis, 6-year-old post-surgery. 6 weeks post-IM nail. See, marked myositis ossificans. Again, picture of it. ORIF, femur after failed fixation. Neurofibromatosis, numerous surgery. Look, hip dislocation there. Fixation, fracture femur and patella. Neurofibromatosis, ulcer, enlarged limb. Fracture femur fixed. Non-union, upper femur. ORIF, mid femur, 10-year-old, box splint. Loss of position, fixation, fracture femur. Subtrochanteric fracture left femur. Pathological fracture in a 53-year-old. Fixation fracture lower femur, 94-year-old. Osteomyelitis around a canal. Supracondylar fracture femur. Pages, look at the deformity there. Fracture lower femur in an 11-year-old car accident. Pathological fracture infection. Subtrochanteric fracture pages. See, transverse fracture, pathological. Again, from infection. Osteomyelitis of femur around canal. Post-IM nail, look at the incision. Osteoid osteoma of the femur around here, causes severe pain, relieved by aspirin. Post-op after multi-trauma, so you can get the patient going. Pathological fracture of the femur, 53-year-old, probably infection. Supracondylar fracture, 24-year-old. Quadriceps contusion here from sporting injury. Recon nail upper femur. Stress fracture femur showed up on the bone scan. Rectus femoris rupture here, common in athletes, hurdlers. Subtrochanteric fracture, 35-year-old. Supracondylar fracture, 8-year-old. Subtrochanteric fracture, 32-year-old, fixed. Subtrochanteric fracture of the femur. Subtrochanteric fracture, osteopetrosis, increased bone density, actually soft as his transverse. Wood splint in the thigh, look at that wood splint. These organic foreign bodies disintegrate, can be hard to get out and retrieve. Supracondylar fracture of the femur, motorbike accident. And again, and again, and again. I hope you find these pictures useful in your practice.